Good afternoon, everyone. This is County Executive Pat Ryan. I hope you are enjoying a beautiful, beautiful day and the tail end. Even though we're in fall, it feels like the tail end of summer. So we'll try to be quick and get everybody back out to a gorgeous day. Thank you for tuning in. Primarily going to talk COVID updates and then one other update on some of our housing, the progress on addressing the housing issues in the county. So overall, COVID situation, we're holding steady and feeling generally good about where we're at. We are below still 1% new infection rate, despite a spike we had about 10 days ago. So we've maintained below 1% now for over a week. So that is good news. The total numbers, to start by the numbers, you can see the total cases there, just under 2,400, well over 100,000 now tested. Thankfully, our fatality numbers are still holding at 95, and we're well over 2,000 residents recovered. So that's the overall by the numbers snapshot. Zooming in to look at the hospitalization numbers, 2 days ago, 48 hours ago, I flagged a concern here that we did see a concerning increase in hospitalizations. We were up to 10. Some relatively good news here. We are now down to 7 hospitalized within the county. One of them in an ICU on a ventilator. We were at 10 total with 2 on ventilator. So good news in that we have had several folks recover and come out of the hospital successfully. Thank you for everyone that was sending that support to them. We still have other folks, though, that are in that situation. And again, we send our love and wishes for a speedy recovery to those 7 individuals. In terms of active cases in the county of COVID-19, we are at 181. That is continuing to slowly inch its way up. And that's something we are watching. We're approaching that 200 mark, which we haven't been at really since July, end of July. So that is a slight reason for concern in addition to the hospitalization numbers being up. The new infection rate is still below that 1%, but we are starting to see another point for slight concern here with the active cases. To give a little more detail on the new infection rate numbers, we are, as I said, below 1%. In the last 48 hours, as a county, we have been at 0.79%, 0.79% new infection rate. That is out of 1,895 tested, 1,895 tested. We've had 15 new positives, so again, that's a 0.79%. In the last 24 hours, we're doing even better than that. We're actually under 0.5%. We're at 0.48%. So even though we're seeing daily numbers relatively low, we are seeing that slight uptick in active cases, meaning it's taking a little bit longer for people to recover, essentially, and we've seen a few more serious cases leading to hospitalization. So we're still looking at what might be driving that, but that is something that we'll continue to watch. As long as we can continue to keep that new positive rate below 1%, though, we feel that we're in a relatively good place. So that's really our collective goal, is to make sure that we can do that. In terms of hospital capacity going forward, we are still in very good shape here. As I said, 7 currently hospitalized with more than adequate capacity looking forward into the future. How do we keep it that way? I think at this point, everybody tuning in knows the answer to that question. The big 3 pieces that each of us can do and really needs to do to keep not just ourselves and our families safe, but the whole community: wearing masks, maintaining social distancing, washing hands or using hand sanitizer, or both if you want to really be extensive. All those 3 things are relatively small, relatively easy, and have proven effective over and over here in the county. So please, please continue to do that. And I think we can hopefully go deeper into the fall and head into the winter in a situation of relative comfort, knowing that we have many more months until we're at a point where we have a vaccine. We really need to be able to keep this in check until then. One major positive development that we've talked about hypothetically for a while that I'm excited to finally announce to this end is that we now have submitted a plan to New York State and anticipate we will be able to get rapid testing capability here in Ulster County, which is a big game changer for us to have that rapid testing capacity, even at a small scale to start. What the rapid testing really lets us do is take a much more proactive approach where when we look at points of high risk, whether those are schools, senior facilities, or other congregate living sites, or other facilities that have been potential cluster areas. Now what we can do with a rapid testing capability is when we see a cluster emerge, we can surge with that rapid testing, and rather than waiting days to get results, we can, within 30 minutes or less, get all of those results back. So that lets us much more effectively and rapidly contain any cluster that might emerge. So this is very good timing that as we go deeper into the fall and the winter, and as we see cases going up in other places, to be in a position now where we think it'll be another few weeks till we actually get this fully ready to go. But today we submitted our plan to New York State, which is required by the health department. Once that plan is received by them and they're good with it, we'll then be in line to get these rapid testing kits and the rapid testing equipment, and we'll get that up and running over the next few weeks. So I'm pleased, and I really appreciate, once again, Governor Cuomo and the state providing these resources to us and across the state. We know, and it makes sense, that the rapid testing will be prioritized statewide to those places with the greatest need and the greatest risk, which right now is parts of New York City, Rockland County, Orange County, and even some of Broome County to our west. But we still are in line to get these, and hopefully we'll have them prior to any need to, hopefully we won't have any need ever to use them, but our goal is to get them in place and set up so that if we do experience a surge, we can use this rapid testing capability. Most likely in Ulster County, we will focus primarily, as I said, on our schools, senior facilities, and other congregate sites. Given a relative limit of the resources, we want to make sure we prioritize those higher risk sites. So more to come on this, but I'm very pleased that we are now taking that first step on getting the rapid testing going. The other thing that I wanted to share, which is not directly related to the health aspects of COVID, we've talked a lot about our broader recovery efforts as a county, and when we stood up our recovery task force, one of the biggest areas for concern, in addition to food, was housing and housing insecurity. And of course, we know that even before COVID, we had a lot of folks that were housing insecure, that were worried or unable to keep a roof over their heads, and we know that COVID magnified that exponentially. So we've been working very closely with the legislature, with other community partners to get ahead of this and try to stay ahead of this challenge. We created a housing advisory committee, and that committee has been meeting and working to develop solutions to the housing crisis that we face in the county. I wanted to make everyone aware that tonight, on Thursday night, starting at 6:30 p.m. tonight, we'll be having a public meeting, a public engagement over Zoom, of course, thanks to COVID. But this is a chance for anyone in the public to do two things. One, we'll share some preliminary data and insights from a report that we've commissioned about really how dire the housing need is in the county, and all the data has backed up the anecdotal evidence that we have a real challenge here across the board. So we'll share some of that data from some housing experts that the Housing Advisory Committee has been working with, but mostly we want to have a dialogue with members of the public and hear the challenges and the concerns and the potential solutions that you all are thinking about and concerned about. So if you have a chance tonight, again, tonight, Thursday at 6:30 p.m. The Zoom link is up on the screen. It's available on our website. We'll put it up on all of our social media posts as well. And if you are willing to share that out among others, I know we have a really active community, thankfully, in the county of different groups and individuals focused on addressing the housing issues, particularly for renters and tenants. So please spread the word among them that we'd love to have you all participate in this session tonight. And we are going to continue to work to address not just in the greater Kingston area, but countywide to address the housing crisis that so many are facing, which has again been made worse by COVID. Those are the big updates for today. As I said, it was a relatively quick set of updates. To wrap up on COVID, I think there are a few small preliminary signs for concern that we've talked about in terms of slight rise in hospitalizations, slight rise in active cases, but overall I think we continue to hold steady, and the fact that we now are able to make real progress on rapid testing is something that I think is a very, very positive development that should make everyone feel better about our ability to keep this in check. But more than anything, again, what will keep this in check is continued buy-in from the whole community to do the little things that are frustrating, but that definitively make the difference in terms of masks and distancing and hand washing. So please continue to do that. Encourage others to do that. Carry a spare mask with you. So if you see someone who's not, you can help them out. And if we continue to do that, then I think we'll stay in good shape as a county. The other way that we'll stay in good shape as a county, of course, is thanks to all of our frontline workers across the board who have gotten us to this point and are going to continue to take care of us and keep us safe and fed and supplied and informed and educated, and so many other things that our frontline workers have been doing throughout this and continue to do. So thank you to all of you as well, our frontline workers and everyone who's tuned in today. I appreciate you continuing to spread the word about what's going on and what we can do as a community. Last thing, as always, if you or someone you know is in need, has any challenges, whether it's problems with a landlord, need for food, issues with childcare for your little ones as you're trying to work, whatever the need may be, you can call our Recovery Service Center, 845-443-8888. We have a phenomenal team that are trained and ready to work with you, to engage with you, and ultimately to help address whatever challenges you or others are facing. So please don't hesitate to reach out there. Otherwise, I hope, again, you enjoy this beautiful day. I hope that you and the ones you love continue to stay safe and healthy and resilient, and we will see you for our next update on Tuesday at 2 p.m. Thank you very much.